revolutionizing medicine with ChatGPT. How ChatGPT is changing the way we think about healthcare.
GPT, or Generative Pre-trained Transformer, is a type of artificial intelligence that has the unremarkable ability to generate human-like text. Keep in mind that this technology is currently in the beta testing phase. It is important to note the limitations. The quality of the responses depends on the quality of the prompts the user enters in GPT. The answers are not always correct. The answers are to be created to feel correct to humans. If the user does not know the area in question, then the answer might be incorrect, and the user may not be aware that it is incorrect. If the data entered is biased, then the data expressed by GPT can be biased. As a result, GPT may not be able to answer. One example of how GPT can be used in medicine is the creation of virtual assistants for patients. These assistants can provide personalized recommendations and advice to patients based on their medical history, current symptoms, and other relevant factors. For example, a virtual assistant could suggest over-the-counter medications or home remedies for a patient experiencing a cold or flu, or provide information on managing a chronic condition such as diabetes. Another potential use of GPT in healthcare is in the creation of personalized treatment plans for patients. By analyzing a patient's medical history, current symptoms, and other factors, a GPT-powered system could generate a customized treatment plan that considers the patient's specific needs and preferences. GPT could also help healthcare professionals with daily tasks, such as transcribing medical records or generating reports. By using GPT to automate these tasks, healthcare professionals could save time and focus on more important tasks, such as caring for patients. For example, a GPT system could be trained to transcribe patient medical records accurately and efficiently, freeing up healthcare professionals to spend more time interacting with patients and providing care. Additionally, it will be important to consider privacy and security concerns when using GPT in healthcare, as sensitive medical information will be involved. Measures such as encryption and secure data storage will be necessary to protect patient privacy and ensure medical data security. Physicians are already using this technology. The most popular example that went viral is on December 13, 2022. Dr. Clifford Sturmer posted on TikTok on using ChatGPT to save time with insurance denials. Get you the care they need. In the video, he asked ChatGPT to write a letter to United Health asking them to approve an echocardiogram on a patient with systemic sclerosis. Make references to supporting scientific literature and list the appropriate articles. It is important to note that he later posted a video telling healthcare providers to check the references that GPT yields. He notes that it is better to cite your own known reference to use with GPT. Overall, GPT has the potential to greatly improve the efficiency and effectiveness of healthcare by providing personalized recommendations and treatment plans to patients and helping healthcare professionals with their daily tasks. While there are challenges to overcome, such as the need for accurate and up-to-date data and concerns about privacy and security, the use of GPT in healthcare holds great promise for the future. Some possible future applications of GPT in healthcare could include using GPT-powered chatbots to provide mental health support to patients, or using GPT to generate personalized exercise and nutrition plans for patients based on their individual needs and goals. GPT could also be used to help healthcare providers with tasks such as scheduling appointments or managing patient records, making the healthcare system more efficient and effective overall. The potential for GPT in healthcare is vast, and it will be interesting to see how it is used in the coming years to improve patient care and the overall efficiency of the healthcare system.
Thanks for watching.
Why do we have 2 books on this subject? The healthcare industry is changing quickly, and AI is a big part of how it will change. 2 groundbreaking books, ChatGPT and Healthcare, take a deep dive into the intersection of AI and healthcare. The first book, ChatGPT and Healthcare, A Call to Action, was written by Dr. Harvey Castro, a healthcare professional and medical reporter with a lot of experience. It makes a strong case for using ChatGPT to change how we think about healthcare. The first book's goal was to take a 10,000-foot view of this technology in healthcare. Dr. Castro has a strong track record of leadership and mentorship, and the author offers valuable insights and solutions for creating a more efficient and effective healthcare system. This book is a must-read for anyone looking to improve healthcare access and drive change in the industry. The second book, ChatGPT and Healthcare, Unlocking the Power of Patient Empowerment, written by Dr. Harvey Castro, explores the role of artificial intelligence in improving patient experience. The book provides a comprehensive overview of ChatGPT technology, its benefits for patients, and its impact on the future of healthcare. Patients have long been passive participants in their healthcare journey. With the power of ChatGPT, we can empower them to take control of their health and well-being. Case studies in the book show the real-world benefits of ChatGPT, and the book also talks about legal and ethical issues. This book is a valuable resource for healthcare professionals and patients looking to take control of their health journey. These two books are a must-read for anyone interested in the future of healthcare. Get your copies today and join the conversation on the intersection of AI and healthcare. It is available.
All right. Well, welcome everyone. I'm excited. I have a special guest today. His name is Doug, and I'll be having him on shortly. Big picture, he's just an amazing person overall. He has so much knowledge, and I'm excited to share his knowledge. Our goal here today is pretty simple. I'd like for us to talk about the technology, see how we can use it in healthcare, and talk about the pros and cons. So I'm going to bring him onto the stage, and he's got a great presentation. And here's Doug.
Well, thank you so much, Dr. Castro.
I appreciate you. So I went ahead and put you're up. You got your slides ready, and you can control them.
Okay, well, fantastic. Excuse me. So I'm going to be my background is I had 33 years as with Motorola and Nokia, and so I'm going to be talking about an AI human collaboration to amplify creativity and innovation. So this Centaur X, which is half human, half horse, but this is half technology. And so how can we use this technology to amplify a doctor's ability, a patient's ability, students, teachers, knowledge workers? So this concept came from Garry Kasparov when he was playing against a computer. And he said, okay, if I'm working with a computer, can I actually play better? And that's how this concept of the Centaur. So he talks about Centaur chess. And the key thing is despite the computer is assisting it, it is the human player who controls and decides the game. So a little bit about me. Right now, I'm at the Kansas University School of Nursing. I'm affiliate faculty. I work on Innovation Advisor and on the advisory board, focusing on technology. I'm also with the VR/AR Association here in Kansas City as a chapter president, and also with the Virtual World Society. So working on a lot of different projects. I left Nokia about a year ago. So I joined Nokia, actually Motorola in '89, and then my division at Motorola got bought 11 years later with Nokia. So I have 33 years in the cell phone business. And so one of the things I'm very proud of is that we brought technology to the masses that we have now. In 2002, we had 1 billion cell phone users, and in 2011, 1 billion smartphone users. In fact, I keep this blog of when will there be 1 billion of something. And then, went from 1 billion to 5 billion. So right now there's about 5 billion people using smartphones, over 5 billion people using the internet. And what power are they being able to do with that technology? Both as if you're a medical professional, a clinician, how are you using this technology to help your patients? And so and then how can the layperson and the patient improve their health with this technology and not to harm it? So I'm a big believer, even though I'm a technologist, first of all, how can humanity stay ahead about this AI advantage? A lot of people are scared out there. And my answer to that is the human player who controls and decides the game. I want the AI and the robots, if a job is difficult, dirty, dangerous, or dull, repetitive, give that to the AI. So I was just at a conference or in a part of this KC Digital Drive healthcare group, digital health group. And one of the presenters talked about burnout. And one of this technology about burnout is the inability of patients to provide the care. Doctors said the inability to provide the care I want to provide. So, yeah, if, this problem with 2 times more keyboard time than patient time for a doctor. So that's what's burning out the clinicians, right? They just spending all this time focusing on, other things and not the right thing. So anyway, give that to, that's a dull type of job. Give that to the AI, and then let, your human ability for creativity, compassion, critical thinking, co-creating, cooperation, those kinds of things. That's how, how we can stay ahead of the AI. And I think also that we don't get burned out as well. So Chuck Schneider, the CEO of Redpoint Summit, he was talking about the problem, because I'm a real big believer on, let's identify a problem first and then figure out what's the solution. So this company's looking at the problem is there's physician burnout. The problem with it, they're spending 2 times more keyboard time than patient time. And then how can you use AI to help with that? So this talk, though, is about, from a patient's perspective, because from a patient's perspective, they want minimum impact of illness to their lives, right? And so, a patient, the last thing he wants to do or she wants to do is see a doctor or a clinician, right? They just want to live their lives. And when they do have a problem, they want a sense of control. They want to be able to have a conversation with the doctor. And I believe likewise, a doctor, I like this slide. This is about 6 years old, but I think it's very applicable when I gave some presentations on digital health. Doctors, clinicians want to practice medicine without the hassle factor. They want actionable information that's valuable to them. They just don't want to throw technology at a problem just for the sake of technology. They want innovation that really makes a difference. So that's the challenge. So I was at this event Wednesday, talking about AI supporting doctors. And, this gave me, I've been looking, throughout my career, I'm business development. I work on strategy, and, the fundamental, you always have the foundation question is, what problem are you trying to solve? In this case, for patients and / customers, and how can generative AI, this technology that's popped up on the scene just recently, though it's been around for many years, but all of a sudden it's just really transformative, no pun intended, or like actually is pun intended. But yeah, this transformation of technology that's really making a difference. And I think will continue to make a difference. So like, if you play around with it now, you may say, well, it's like, like a 9th grade, education, but then all of a sudden it's like a, high school education. All of a sudden it's like a college education. And then it keeps getting faster and faster at an exponential rate. So, my premise, when I talk about how to use this technology, is how can we use this generative AI and XR technology to help solve problems? So if you're not saving at least 30 minutes a day using AI technology, you may not be understanding the benefits of AI. So that's what, Dr. Castro and myself are trying to help, clinicians and the patient understand this technology to benefit them. So, one of the challenges is when I worked at Nokia, worked in digital health, 50% of patients don't adhere to their recommendations to their doctor. 25% of hospital admissions are need to come back because of that. There's 100 in the United States, 125,000 deaths, and between 100 and 300 billion dollars of medical costs annually because of patients don't understand or don't help, follow through on what the doctor or clinician is recommending that they do. So, one person I follow a lot as well is Shelley Palmer. He does a lot of material on AI, and he writes, I think he says about 5,000 words a day. And his comment was, I use ChatGPT 3 to 5 times a day. And it's very valuable, he said, to him, where I know the information and I can be my own fact checker. Yeah, so like right now, it provides a good first draft, and think of it as brainstorming first draft. And then as the technology keeps getting better and better, it will get, you'll be able to use more and more of it. So, his was one of his, as he's trying to explore, how do I use this and how do I get benefit? But he says it's saving him 20 to 30 minutes a day. And he's an excellent writer. If you follow his material, he does fantastic work. And it's like, if someone like him can get benefit of 20 to 30 minutes a day, and oh, by the way, I was able to do as well, saving me an hour a day, you should be trying to think, okay, what problem am I trying to solve? And can AI help solve that problem? So I'm not going to read this, of course, but you know, I was at this health plan, this digital health group, and you know, I said, you know, like, okay, you know, I know this problem of 50% of patients don't follow treatment plans, right? And so how can patients have more control of their health when they're not following the plan they're supposed to be following? And so, you know, within 10 minutes, I was able to create like 4 or 5 pages of information that summarized well, gives me links. That's the value of Bing, because it lets you get links and you can evaluate the links. So you could go in and click on any of these things. So, you know, this is just one slide of many, but, you know, there's many factors of why there's not adherence to treatment plans. And then how I asked them how are ways that doctors and nurses can help with the development of these treatment plans. And so that came over here. And what I put in red, and again, all this material will be up on the website, so you can look in details. But you know, where keep it simple and clear, you know, strengthen communication by asking open-ended questions, empowering patients. And probably, you know, this is like, okay, you already know this, right? But it's kind of a reminder, especially for a younger clinician. Maybe this is, you know, okay, having this list is helpful, right? And you're like, am I missing something? So, you know, this is just one example of this information. But you know, like I said, I created a lot of pages of like, how can generative AI help? Find me references on a lot of different material. So there's that. So why is this important? Well, you know, 43% of working adults, this is from England, don't have the literacy skills to understand and make everyday health decisions. And that leads to 75% increase of premature death. So, you know, if you go to WebMD, Mayo Clinic, you'll see 11th grade reading level. NIH recommends 6th to 7th grade reading level. So again, how do I get the right information to the patient that they make good healthcare decisions? So, you know, I was playing around with ChatGPT and I asked, you know, for a teenager with diabetes, create a SOAP plan, right? Note for this. And so it created that. And, you know, I thought the most important thing was here, you know, educating the patients, you know, again, going back to adherence, is educating the patients on the importance of monitoring blood sugar, right? Is a partnership with the doctor. You know, if the patient, you know, the doctor can't solve it all. They need the patient to step up and follow the plan and really feel like they have some ownership into helping improve their health, especially with diabetes. So then I was asking, well, here, you know, how would you communicate this to the patient, you know, to this teenage person? And, you know, they started giving me some information, you know, and so, you know, the thing I thought was most valuable from a ChatGPT perspective is help empower the teenager with diabetes to control their health and effectively manage their condition, right? Again, that stuff, you know, but maybe when, you know, think of a teenager reading this, you know, yeah, they get it from the doctor, they get it from their parents, but, you know, if they get it reinforced with ChatGPT, you know, they're asking questions, just like people are Googling, medical Googling. They're going to be medically, you know, interacting with ChatGPT and other chatbots. So, you know, trying to understand, and maybe from patient education is saying, okay, how do you vet the information is good or not? So I said, you know, okay, that's a lot of words. So let's summarize it with less words, right? And so again, you know, so ChatGPT within seconds gave me this information, right? So just very quickly, I can have a dialogue, and if I don't understand, you know, I could say, okay, expand on point number 7. Now, you know, one thing I wanted to stress here is, you know, when they looked at these 7 areas, the one thing I thought that they missed, and maybe, you know, when we have questions and answer, we can talk about this a little bit later, but, you know, look at this list of 7, you know, what's being missed. Now, I think it's support groups, you know, which is very critical, especially for the teenager. So is there something else being missed, right? Because go back to Shelley Palmer, you know, GPT and this AI assisted technology is good if you can be your own fact checker. So that would be something I would emphasize as well. So just want to make sure. Yeah. Okay. I want to make sure everyone's hearing me. Okay. Okay. So again, support groups, I think, is really important. The other thing is about this technology. I mean, right now there's a lot of hype there, but, you know, I've been looking at Watson Health for a long time, for the last, you know, 12, 15 years, and been following some of this. In fact, I gave a presentation to nursing students in 2015. And I've actually brought in some slides from this in the background. You'll be able to see that as well. But Watson Health was born in the 2015 timeframe. IBM Watson, they invested $4 billion plus initial development in this. And oh, by the way, then the rumor was last year they sold it for $1 billion to Generative Healthcare. So one of the things that I thought was interesting in this article, was the issues of data collection and interoperability hindered IBM's AI system. The company was too optimistic about AI's potential in this sector. So, middle of last year, they actually sold their company and took a fairly big loss, it looks like. Not exactly sure, but, and this is a good website that, this person from IBM, comparing ChatGPT to Watson. But I think this is a tale that we need to understand, what's the pros, what's the cons, have a critical eye for this, but get the benefit and realize the risk of this technology. So Watson, this came from Jeopardy. Remember in Jeopardy when they were playing against, Watson's playing against Jeopardy, in which, they won. So they were doing a really good job against that. And this came from, about 7 or 8 years ago, right? Comparing. So I don't know if any of you on this call have used IBM Watson, but, there was a lot of promise to this. I like what Dr. Warren Slack said, from Harvard Medical said, any doctor who can be replaced by a computer should be, right? But I believe, and he was joking, well, kind of joking, right? Because he doesn't think that many doctors can be replaced, right? But if you can be replaced, you should be replaced, right? So you need to be better than the computer. But my answer is not replacing the expert, but complementing the expert with the right tool. Like, how can you use these tools to help you, one, to minimize burnout, and two, to help your patient? And how can your patient help themselves to better understand their condition, and what can they do to partner with you to have a much healthier situation? So, one of the challenges, I have a friend who's a nurse practitioner, and she was, she gets frustrated with this medical Googling. And I joked, I said, well, so my 10 minutes of my medical Googling or using ChatGPT is not equivalent to your 8 years of medical studies and your 20 years of medical practice, right? So, there's something called the crooner deadening effect. And what they say is, very quickly, you're saying, oh, I'm using ChatGPT and I know all this stuff. So they call that, I like this slide, which is the peak of Mount Stupid, right? You have a lot of confidence, but you really know nothing. And then, as you learn more and more, you realize some of the challenges. And then finally, as you get more and more wisdom, you realize, that's when you really understand the situation. But again, it's a partnership. So these are things to think about. One thing is anecdotal information. Again, when you go to Google, when you go to ChatGPT, this is why it's very critical to have critical thinking when you're using this technology. I like this slide, which is the oldest person, a woman in Japan at the time, said, well, ascribed her longevity to sleep and sushi. He said, oh, that sounds good. Of course, this older British gentleman said, well, it was cigarettes, whiskey, and wild, wild women. So anecdotal information is not always the best. This is about robots, lawyers coming in and highlight from Legal Ego. It's really funny. But it's, is this a good idea that robot lawyers come in and take over? And and he's like, I, for one, welcome our new robot lawyer overlords. But then he, talks about, why sometimes this is not a good idea. So Peter Diamanus says the day before something is truly a breakthrough idea, it's a crazy idea. But I say most of the time, crazy ideas are just crazy ideas. So, something to think about. I mean, remember Theranos, where it's like, oh, here's a crazy idea. Well, it crashed and burned. So it's very good to vet this technology. I'm a big believer in crazy ideas. Don't get me wrong. But, really vet the information. First do no harm is something to think about. So, I'm working with this one company, OnCall Hub and nurse triage. When you're having a medical condition, the question is, do you do home care? Do you go to the doctor in the next couple of weeks, the next couple of days, today? Do you go to the office now? You go to urgent care, and so forth. You go to the emergency room by car. You call 911, right? So the question is how much information do you do, and when do you use that information? So there's companies like this that's trying to help guide, using expert systems to guide the patient to be more in control of their health and know when they should. The problem is people go to the emergency room and they spend $30 billion going to the emergency room when they don't need to. But the flip of that is if they don't go to the emergency room and have a bad outcome, that's bad as well. So there's this balance in tension between when do I go and when don't I go, and that's kind of the challenges as well. So this technology, this internet.org. The reason I put this up is they talk about the barriers of going to the internet, and the first is availability, right? Do you have availability? If you don't have availability, then it doesn't matter how much it costs. Then you have affordability. Then the next level is relevance to someone's life, right? Is there a reason why I need to have this information? Like I have diabetes, so yes, that's going to be very relevant. But then do you have the readiness to use this technology, right? So, you can have affordability and availability. And by the way, this being a technologist, we're going to get that. We're getting that right now with communication and so forth. And now it's like, okay, showing that this is relevant to people's lives. Again, if you're not saving 30 minutes a day with this technology, you don't understand, why, you need to get the readiness to understand how to use this technology, which is why Dr. Castro, I think, is so important. He has these webinars and trying to test this technology today, because maybe it's not ready for prime time today, but in the next 1 year, next 2 years, next 5 years, it will be. So making sure you understand the relevance, and then finally the readiness of your patients to engage with this technology, I think is really important. So, I'm a big believer in critical thinking. And, this is one of my favorite poems, that, it is AI can intoxicate the brain, right? But you really need to have critical thinking to largely sober, first do no harm. Try to understand the technology, when you can use the tool properly, and when is just throwing technology at the solution a bad idea, right? And it's going to do more harm than good. So these are things to think about as well. So right now there's a lot, it's kind of, there's these waves of everyone's excited about technology and then everyone's scared of technology. Hollywood does a great job, and it's like, what best reflects your view of the future of AI? Right now they did a survey and said 9% think that AI development will do more harm, more good than harm, excuse me. So they're only 9% are positive. 46% will think that it will be about the same. They're neutral, and 41% think it will do more harm than good, right? So they're thinking this is a Terminator world, right? The computers will take over, the robots will take over and destroy us all. Personally, I'm more concerned about the Wall-E world example, where technology making us lazy, apathetic, ignorant, helpless, and lonely, right? So how do we use this technology appropriately? How do we use critical thinking is so very important. So when I talk to students from second grade to college level, and I talk about this technology, how to use this technology. And Hero 6, I don't know if you've seen this, is Baymax. Actually, he's a health your healthcare companion, and is not deactivated until you're satisfied with your care. And how this technology helps us to complement, helps us to make new human friends in the physical world, share our passions, and keeping us from being distracted and out of harm's way. So this is a technology I want to be working on. So when will there be 1 billion people using this technology? I'm actually predicting that by 2025, maybe it's even as early as 2024, we'll have a billion people using this technology. And greater than 100 million people paying for it, saving at least 30 minutes a day. So that's the technology I think is going to happen. And, once that happens within 5 years, and personally, because a lot of people, there's 5 billion smartphones out there, I think maybe within a year or even 2 years, we may have 5 billion people using this. So as a clinician, you need to understand how are your patients using this technology. Just like they're using medical Googling information, are they making poor decisions because of this information? And how can you guide them to use this information properly? So use it as a tool to help them as opposed to saying, no, don't watch it, or because they're going to do it anyway, right? So how can you help them, educate them with critical thinking skills, saying, okay, this is the information you got. Let's see, which ones you think are correct, which ones don't you think are correct, and let's work together as a partnership so that you have better health outcomes. So in fact, you can say, are you following the advice of your doctor? And if you're not, you realize how dangerous that is, and that you can actually, this is a partnership with healthcare. So how can this be another partner in that, between the doctor and the patient, where the patient can kind of, if they have questions, they can ask questions to ChatGPT to get clarity, and then come to the clinician to say, okay, do I understand this or not? So anyway, this is I have a lot of backup slides in this, but these are one of the thoughts I had right now about using this technology, and I'm just excited for it. I think it will could make a big difference in healthcare of people, and help in the education as well. And so I'm just excited for this, and looking forward to having questions and talking more about this technology.
Well, awesome. I was going to say, if you have some more slides, if you want to keep going, I love your slides. It's up to you.
Well, I can. I'll go quickly. How about this? I'll do another 5 minutes, and then we'll go.
I'll jump in, and I have some things to say after you go. So
okay. So when I talk to students, I talk about the 9 different types of intelligence that they're at. And so for me, I'm really good at engineer. I'm good at math. I'm bad at spelling, and I'm horrible at art. But a lot of this art is generated by Mid-Journey, generative AI. So also I'm able to do a lot more creative things because of this technology. So, if you already have some, skill sets in certain areas, that can amplify, and you can even get better, right? But if you're weak in a certain area, how can I use this technology to help the student where they're weakest, and also strengthen where they're strongest at as well? So there's these technologies out there. I follow this one site that says, where are the AI tools to help you be a superhuman, whether it's generative art, chat, text to video, music, and so forth. I copied this about 3 weeks ago. We're now up to over 850 different tools out there. So all these tools are exploding. This reminds me, if you're old enough to remember the .com days, this reminds me of that. And what's going to happen is you're going to have probably thousands of these companies springing up, and then you're going to get down to 5 or 6 that are actually going to really be successful, which is the Bings, OpenAI, and so forth. But that's the question. So this is a good site for that. Matt comes in, Matt Wolf is his name, and comes in and says, these are my recommendations and my top, these are all of them that are out there that he found, and these are my top picks, which I thought were very helpful. Of course, they're in the news, everyone's saying, how many people are using this technology? Right now there's 10 billion internet searches a day. I should have looked up how many of them are medical related, but my guess is probably 10%. I'll look that up, so I'll have that statistic in the future. This is without, the interesting thing is 64% of these searches don't get a click, right? So now maybe they have enough information on the page itself, but it'll be interesting, these 10 billion searches out there. Bing is coming out with their tool. I recommend, I use Bing and ChatGPT interchangeably. Sometimes one works better for me than the other. There's guardrails on the way people use it. But the thing I like about Bing is it does search and chat together and gives you answers. I find it useful. Again, you have to fact check. You have to be your own fact checker. So, it's just not regurgitating the information and putting it on the page. In fact, when I talked to teachers about this, I said, what I would do is have the student send in their paper and have ChatGPT generate an individual quiz about their paper. And so if they get 10 on it, then they get an A, right? As long as the paper's halfway decent. But if they can't answer 5 questions, they're going to get an F, because clearly they don't understand their paper, right? So have ChatGPT generate a quiz about the paper they wrote. And by the way, have ChatGPT grade the paper as well. But that's, because I care about learning. I care less about, how they learned it. for the student. So anyway, that would be my recommendation there. Of course, there's all these people talking about how many billions of dollars are going to be generated because of this technology. My estimate right now is by 2025, we're going to be somewhere between 24 and $240 billion. Probably by 2030, we're going to be about $600 billion around generative AI. That's still a huge number. So this is all of AI happening. So, we're in the trillions of dollars. By the way, that's about the same size as the cell phone business out there. So this smartphone business is about a $2 trillion business right now. So just this huge amount of opportunity coupled with, communication with AI can do tremendous things. So I'm really excited about that. If you go to the site, if you scan the information, you'll see about, different sectors. Gabriel Rene, who's the founder of Versus, has a really good presentation about the value of the AI in this company. So I highly recommend watching that video. There's another person that shows, the internet's, enterprise value creation was around $15 trillion. And he's, the AI, they're talking about it being $85 trillion. So I think this is a lot of hype personally, but I do think we're going to be in the, could be $20 trillion of enterprise value, and hopefully I'm wrong. Hopefully I think because I would like this value to be to the people. Like, how do you amplify humanity's ability to do amazing things? So I'm hoping that there's a lot of drug discovery going to be happening, a lot of people getting cured from diseases, a lot of, improvements of health, education, all kinds of things because of generative AI, and the ability to partnership with AI, I think is going to be critical. Of course, there's all this hype out there. People are saying, oh, there's going to be 1 billion people using this technology. My comment to that was is like, well, at this rate, we're going to be having 1 trillion people, in the year. And, so you got to be careful on the hype. In fact, Sam Altman from OpenAI said, hey, we got to think critically about these technologies and discuss their limitations. So the people who really understand this technology are saying, slow down a little bit, take a deep breath. Don't get overly excited, but there's all this opportunity. If I would go to one spot, this is a good slide because it talks about how quickly this technology is. In 2019, this theory of mind, it didn't even register, and then all of a sudden now, ChatGPT is starting to act like a 9-year-old. Yeah, in fact, how I looked at it is, when I was playing with even 3 years ago with chatbots, I felt like they were like a toddler, right? They're cute, but not very productive. And now, they're acting like, personally, I think they're acting like a very smart teenager who think they know it all. So that's something to consider. Because 95% of the time, a very smart teenager who think they know it all is right because they're very smart. But that 5%, they can be doing very dangerous things. So this is where the technology is going. I do think creativity and learning is going to be really important. And how do you encourage creativity, education? And so I'm very passionate about the future of education as well. So, we're going to be amplifying creativity, just like the smartphone. We went from tens of billions of pictures in the 2012 to now we're in the trillions of pictures taken every year. So all this artwork being created, all this pictures being created with this technology, we're amplifying creativity. We're doing the same thing with words. We're smart. The problem is are these words useful, right? Is there value in this as well? But a lot of words are being created. And Dr. Alan Thompson from Life Architect, if you had to go to one site, if you wanted to follow, this is the site I would recommend to follow right now. So, there's this amplifying creativity. So Kevin Kelly in the book, Inevitable, Understanding the 12 Technology Forces That Will Shape Our Future. He wrote this in 2016, but it's timely today. And he talks about all this information out there being amplified. But I respond, well, consider the creativity or the crap when every person is an author, artist, musician, and video producer. So we're going to have lots of explosion of all this creativity. The question is how much of it is valuable, who will look at it. So these are the things to consider. So I'll close with this, which is Peter Diamanus from the X Prize. and Abundance Digital. He says the real power of AI lies in its ability to find hidden connections between obscure bits of information, connections no human would ever notice. And that's what I think will amplify creativity. And with that, I thank you for your time and look forward to your questions.
Awesome. Well, thank you. I'm going to jump in just a little bit and then we'll do the Q&A, and I'm having people post their questions and then we'll highlight each one of them and kind of go over them. So, big picture, thank you, Doug. I always love your presentations. I always tell him that all the information he sends me, I literally bookmark, because if I don't have time to read it all, I make time. So I appreciate you coming out, and amazing presentation, truly amazing. So I appreciate that. And then any information that he mentioned that he wants to post, he'll put it in the comments on LinkedIn, and then you guys will have that, and that'll be evergreen. So if you want to share this post with others. So let me just jump in real quick. Basically, as a physician, I see a couple of things. Is ChatGPT ready for prime time? No, I do not think it's 100% ready. And let me preface. Obviously, there's several things that we need to mention, and we'll talk about it during the Q&A. But number one, obviously, there's ethical concerns. There's bias that we should talk about. There's obviously the part of the sense that we start talking about this hallucination effect. If someone asks a certain question and ChatGPT, here, I'm going to turn off the stream.
Okay.
That way it's just us. Yeah, there. Now you keep going. And so this way, if somebody were to ask a question, and let's just pretend I use this example as an example. I'm an ER board certified physician. I can look at anything that's ER related and look at it, the output from ChatGPT, and say, you know what, this is wrong. But I'm not. I always use this example. One of my friends is a pediatric cardiologist, and if ChatGPT were to put something out in that space, I could look at it, and as a doctor, I could say, you know what, that looks about right, and I could probably give it a rubber stamp of approval. But I am not a pediatric cardiologist, and then I can show that same information from ChatGPT, and the pediatric cardiologist look at it and say, "Oh God, Harvey, no, this is half true. The other half is totally wrong. Does not apply." And so I use that example because obviously we go to ChatGPT because we have a question. And so my worry, especially third world countries, are places where they may self-diagnose, they may run to the pharmacy, get medicine, take it, and they have the wrong diagnosis. And so I see some harm there, and that worries me. The reason I'm so big on ChatGPT and healthcare, and I created this hashtag, and I have 2 books out, is mainly because I want to bring rise awareness to the issue, rise awareness for the patients, and that's why you're here, Doug, and to kind of give us a glimpse of the future. And then on the doctor side, to understand how to use this tool. Because the way I see it, no matter what, people are going to use this tool. The difference is if we can educate them now, then they can use the tool better and understand the risks that they're taking, understand better what's going on. And the other things that we haven't even mentioned is the privacy laws. Obviously, each country has their own privacy laws. Here in the United States, we have HIPAA. And believe it or not, there's 18 identifiers, 18 different things that companies need to make sure that is not leaking into OpenAI. And so that's another issue that we'll discuss. How do I see ChatGPT being used today? Well, there's several companies out there racing to start using it. And is it ready for prime time? I don't think so, but it's all depending how they use it. And so let me explain how I'm seeing used. Big picture, when ChatGPT announces their API, and that's just a way to integrate with OpenAI, I foresee the floodgates opening in all industries, including healthcare. And everyone's going to be jumping in to use ChatGPT in their industry. Some of those things, depending how they use it, may get regulated by the FDA and may get shut down immediately. Some of them, unknowingly, they may violate HIPAA laws and unfortunately get shut down again. And I wouldn't be surprised if there's some case studies where something happens and unfortunately someone gets hurt through ChatGPT. So this is why, again, I'm a big advocate of talking about this subject. Let's explain, and in a minute we'll just go right into Q&A. But I wanted to cover just these topics because I don't want you to think that we're naive to these topics or we have no idea. No, we're aware, and we're so aware that we want to make sure that we're advocating and explaining these things. And so keep putting questions in the question and answers portion here. So I'm going to show the first one. And the first one, thank you for posting. Do you think in healthcare setting that if a patient asks for a second opinion, that it would be ethical to sell them an AI opinion? So I'll let the patient Doug answer that. Then I'll give my 2 cents. What do you think, Doug?
So what I would say is no, because a second opinion needs to be from a medical clinician, professional.
Yeah, and I agree with that statement. I mean, to your point earlier, for better or worse, I went through med school and I have a lot of years in the trenches, and that opinion, right now cannot be replaced by AI. From an ethical point of view, I'm sure, Doug, you heard the story of a mental health company using ChatGPT to answer questions for a patient, and the patient didn't know that they were speaking to AI. And obviously, for ethical reasons, that was wrong, and I don't agree. But I agree with you. I don't think it's there.
Yeah,
But
the one comment I would
go ahead.
have on that one, Bill, is I think it would help the patient to clarify their question. Like when sometimes when I waiting for results of a treatment or whatever, it's like, okay, I think through, okay, what questions do I want to ask the doctor?
Yeah.
So okay, let's say I have diabetes. I don't, but let's say I have that. And so it's like, okay, I can ask ChatGPT to say, list 10 things I should ask the doctor if I have diabetes. So it kind of gets me thinking of what things should I be thinking about? How can I be again, at the end of the day, how can the patient help the doctor in a partnership to improve my care, right? And so while the second opinion has to come from someone else who's a professional, having the patient better understand the situation, and this goes back to patient education, is so important. So anyway, that was my own guidance for that.
Yeah, and I want to jump in on that one. Again, I think I'm hearing physicians using the tool, and I think it can be used. But let me preface: I have an algorithm out, and I need to start posting on LinkedIn, and I will. But basically, it goes like this: if a patient is using ChatGPT, but finally, it's got to have somebody verify it. I don't recommend just ChatGPT says X and we just run with it. I strongly recommend, especially in healthcare, if that's going to be the case, that we run it by a human being, obviously a physician, and not just any physician. Just because they have an MD doesn't mean they can do it. Case in point, I've unfortunately been on a plane where there was a code, and they asked if there was a doctor, and a dermatologist raised his hand, and then I raised my hand, and the dermatologist looked at me. It's like, dude, you take care of this one because I can't. And
Right.
so, with that analogy, same thing with ChatGPT earlier, the same thing I said. So make sure you're using the correct one. So good question. Let's go to the next one. All right. The crying need is for tech tools that help physicians who today spend half their time as overtrained data entry clerks. Okay. So, yeah. And let's see the next one. Keep posting your questions. A human can express opinion, give opinion, then self reflect, revise information, and correct opinion if necessary. How should we deal with the improvement when working with AI as a healthcare advisor? All right, so I'll let you jump on this one, and then I'll
Yeah. So I'm doing it from the patient's perspective. I'll let you do from
yeah,
the
yeah.
doctor's
Yes, sir.
perspective. So patient's perspective is like, okay, again, I know very little, right? I do a medical Googling and I see whatever comes out, right? And so how can I help have a better conversation with my doctor, with my clinician, my nurse practitioner? At my level, like, so if I only understand at a sixth grade level, I can say, ChatGPT, give me information at a sixth grade level. And what kind of conversation should I be having with my clinician, right? Because one of the comments in ChatGPT was, make sure that the patient is repeating, like, how did you so you give all this great information, like, I probably spewed a lot of information to you. How did all this information, how did it affect you? How's it going to be actionable information that makes a difference in your life, right? And so I think that's, from a patient perspective, is really important, is using this tool to help get you up to a certain education level so you can have a better conversation with your doctor.
Yeah, I'm going to take that to the next point that I usually make on these presentations. Number one, I see ChatGPT currently in two phases. Or as a patient experience, we see you before the patient, it's what's going on, like what you mentioned. During the patient experience is when I'm seeing you, and then after. In my opinion, right now, I think it can be used pre and post visit, meaning pre visit. it'd be amazing to have, like your example to diabetes, amazing to have a patient go through all their questions before seeing the patient, before seeing the doctor on ChatGPT, in the sense that they can say, okay, I have high cholesterol, I have diabetes. What should I ask my doctor? What should the follow-up questions be? That way, when I see the patient, believe it or not, most patients only get 13 minutes with their doctor. And that's 13 minutes, including the time to check in, triage, weigh yourself, weigh all that stuff. So you're really not even getting 13 minutes. And so wouldn't it be ideal to be able to get the most out of your physician? Because how many times have you seen a doctor stepped out and said, darn it, I wish I had asked this, because now it's going to be a while for me to get that question. And so that's one way. Post visit, I love this example because one of these hospitals in Europe is doing the following. They took pediatric discharge paperwork that the hospital gives a child on asthma. And what they did blew my mind. They put it into ChatGPT and said, talk to it as if you were talking to a 5-year-old. So they converted this discharge instructions that was meant for mom and dad into basic English for a 5-year-old. And as we all know, 5-year-olds, you'd be lucky if you get a minute of their time and explain it and try to explain healthcare and make sure they take their medicine and don't leave their inhaler and all these things that you need to. And so what they did is A, they converted it. B, amazing, they took it into Dolly and created a cartoon picture like discharge book and basically combined the two, gave it to the child. And now the child can color, can see, can analyze, can take it to their level. And now they're more likely to understand their disease process. And so I was blown away. I was like, man, this is the way it should be used. So to that question, that's kind of how I see that one.
Oh, I like the coloring book example.
Yeah, that was good.
And you can do that really easy. Just say, hey, create a coloring book for a disease state, right?
Hmm.
And so at least a 5-year-old can do coloring
Yeah.
and maybe learn, like what are 2 things you want to learn through this process. That's a fantastic idea. Again, it's all about how do I engage the patient so that they feel like more in control of their that they follow the treatment plan that the doctor wants them to do.
Let's see, I just got another question. I haven't read it, but let's look at it. It says a major driver of excess costs in healthcare is a variety of care. 3 providers, 3 opinions, 3 approaches, 3 pathways, etc. I say AI is the one way to drive variability of care down. What do you think? Well, that's a good one, Doug. From a
Well,
patient point of view.
I'm a big believer of best practices, and so I would say let's get the medical board to come up with the best practices and then feed that into a large language model. So, but it has to come through the best practices of a medical board. That would be my guess.
Yeah, no, good job. And Max is a friend of mine, so thank you, Max, for posting. He and I went to school. We got our MBAs together, so a little shout out to Max. For my angle is the following. Um, let's talk about this. Everybody talks about ChatGPT, and for us, a lot of us don't know anything other. And so for a lot of us, they assume that ChatGPT was the first to market, which in sort of ways it is. But believe it or not, there's been other large language models out there for many years. And as Doug mentioned, there's been other companies that have tried to do the same thing and have failed. And so I like saying that because do I personally think ChatGPT is going to be the gold standard, or the way these pathways like Max is talking about that will eventually be that one gold standard? The answer, in my opinion, is no. I think it's going to be another type of GPT. It may not be this particular brand called ChatGPT, because I see ChatGPT as a kind of like a shotgun approach. It does a lot of everything and it does good. And I'm going to insult my profession in the sense that it's a good ER doctor, in that it's really good at a lot of things. But when you take it down to something core and go really, really deep, you're not going to get it with ChatGPT. With that said, the future is bright. I do believe there's something called BioGPT. And in my opinion, again, as of today, I think that will be eventually the gold standard in healthcare. And what I mean by that is, think of the brains that are going to the database. It's only being put healthcare information. So as doctors, PubMed, and different medical literature, imagine all of that just going into one database and then being able to ask that healthcare database a question. It won't know anything about politics. It won't know anything about how to do a better post unless it's about a healthcare post. And so fast forward, do I see that working in healthcare so that we can actually have some sort of GPT in healthcare? The answer is yes. So sorry, that was a little long-winded, but just wanted to cover that. So thank you, Max, for covering. Any more questions? We're getting close to the end, and I don't want to keep everyone's valuable time. I know everybody's pretty busy.
Yeah, I would make a comment. So Sam Amberson has a book out called The Half-Life of Facts. And, I think it's like the average fact is, maybe 10 years old, right? And so going back to those three different treatment plans, well, one of my questions is that because the information is outdated, right? That in fact, at this health summit event, they said that the average doctor needs to read 400 articles a year. I don't know if your viewpoint on that.
Yeah, let's just talk about that. The literature I've read says between every 72, 74 days, our medical literature doubles, which
Mhm.
is amazing. It's crazy to think of that. And if you think about it a little further, that's probably why doctors are not your general doctor. They specialize in geriatrics, pediatrics, in my case, emergency. The information's coming so fast and so strong that it's hard to keep up. And then that makes me make another argument. God forbid a physician is not keeping up with times. Technically, I hear the argument, well, ChatGPT is only updated until the year 2021, and it's passing USMLE step 1, step 2, step 3, which are the tests we take to become a doctor, but it's still antiquated. I can make the argument that unfortunately some of the doctors in my profession have stopped keeping up to date. And I could argue that ChatGPT may have more information and they may not know if it's true or false because they haven't been keeping up. So kind of playing devil's advocate a little on
Yeah,
that one.
I saw a picture, and I need to find this because it's the difference between when medical science says this is bad to when it falls out of use, right? So, like for instance, mercury enemas were a bad thing, right? And but like Lewis and Clark, they used that, because they thought that was a good thing. Bleeding, leeches, those
Oh
kinds
yeah.
of stuff. Like I have a friend who had chronic myelogenous leukemia, and Gleevec, if those who know about it, is the wonder drug. And so before that drug, you would have died within 5 years on average. Like 50% of people died after they either did a bone marrow transplant or not. But with that wonder drug, Gleevec, now they have 3 or 4 other kinase inhibitors. It is the wonder drug. I mean, we wish that we had every cancer was like a CML. But the thing is so CML came out, I think, in 2001. There's a great book on that, by the way. And then in 2000, let's say 5 years later, I'm not giving any more details, that my friend got this. If the thing is I was trying to, give some guidance in this, and it's like, okay, forget anything that was published that 3 years or older that has if it says interferon on it, do not follow. That's old information. It's worthless. The only information you look at is Gleevec or above, right? And I'm a technologist. I mean, we're right now working on 5G technology. Every 10 years, there's a new G. And, if you're not looking at I throw away everything I learned 5 years ago needs to be thrown away because it's irrelevant to or usually irrelevant to the conversation.
Yeah, and that actually is a great transition to the next question, Max. I'm afraid to sound inflammatory, but doctors might have a tough pill to swallow when they will have to accept that AI can be smarter or better in anything. I see that as a barrier or acceptance. And let me tackle that one a little. Yeah, that's a tough one. And I know there's a lot of fear in people saying, "Hey, I'm going to lose my job." And I've been quoted by saying this. I don't necessarily think ChatGPT per se is going to take your job. And I'm going to apply this specifically to doctors. I think it's the doctors that don't use a GPT equivalent that are going to be replaced by a job. And let me explain. As a hospital administrator, I was hiring and firing doctors, unfortunately, and I had to make the decision of which doctors I needed to keep and which doctors I wouldn't. Fast forward, if I have to look at a doctor that is being very efficient with my patients, giving the best care, having second opinions maybe through AI, or right now, back in the day, to make the same comparison, is using their smartphone to look up data and look up to date and look at the latest standard of care, then those are the doctors that more than likely are not going to get sued. Those are the doctors that are more likely going to be loved by their patients because they're giving them lots of information and teaching their patient, versus those doctors that may be stuck on the last journal and maybe they haven't kept up with those 400 journals that you talked about, Doug. And so, in essence, I would probably hire the doctor that is more efficient, the one that's giving a better care. And not necessarily that I'm picking the one that's doing ChatGPT. No, I'm just picking the one that's being more efficient. And in essence, they're going to end up losing their job because they're not the ones using this technology.
Yeah. Think of it as a tool, right? Am I using a tool to amplify my ability, make it easier to do my job?
Yeah. No, good question, Max. No, that's lots of stuff to think about, and we're gonna have to do this more often because I think from a patient's perspective and a doctor's perspective, it's a little different from both sides. My end goal is honestly, this is who I think should be at the table when this technology develops and grows. Because yes, Microsoft owns ChatGPT, and they're gonna look at it with the dollars in mind, and they're gonna look at it with a different lens. But when we look at it from a doctor's point of view, a patient's point of view, I feel like that is going to be the end product that we need in healthcare. And I think that's going to be the one that's going to help the most people. And I'm just biased because obviously I'm a doctor and Doug's a patient. And I feel like, if you and I were in a think tank working on a product for healthcare, I think we would come up with something that would be very usable on both ends.
Yeah. Yeah. I mean, I go back to that one slide I showed, which is it is a partnership between the doctor and the patient, right? Like healthcare is at its best is a conversation between a doctor and the patient trying to solve a problem, right?
Mm.
And I believe this is a tool that can aid in that, so that patients can have a minimum impact on their illness, and the doctors can have innovation that really makes a difference. So with that, I hope everyone has, both a patient and a doctor has a healthier life, and look forward to using this technology to make a difference.
Yeah. No, I appreciate it. Please feel free to post the questions especially on LinkedIn, because we're on there and we can answer them. If not, I encourage everybody to join our ChatGPT and Healthcare. It's a LinkedIn group. It's free. Just come and join us, and then we can post these questions and answer them. And then we'll be doing this again shortly. And Doug, don't hang up. I'm just going to take you down for a second and
Okay, sure.
here. All right. Thank you, everybody, for joining. I appreciate everyone's time, and we'll definitely do this again. Feel free to contact me, and if you have any questions, just put them on the comments. Thank you so much.